Say yes to new beginnings.
Yes.
Say yes to new standards of excellence.
Yes.
Say yes to engaging reportage with a difference.
Yes.
Introducing Yes International Magazine. The time to say yes to your dreams and aspirations is here.
Permit me to share this brief biodata of our guest tonight. Dr. Abayomi Ajayi is the Managing Director of Nordic Fertility Center in Lagos. They also have branches in Abuja and Asaba. Yes, Dr. Abayomi Ajayi is 59 years old. He was actually born on March 16, 1961. He's from Abayomi in Ogun State. He is a graduate of the popular Semes Grammar School of the University of Lagos. He's a trained obstetrician and gynecologist, a fantastic soul. You know, I've known him now for almost 8 years. You know, I remember the last time I went to Ikoyi and I've had a father-son relationship with him ever since. Tonight's discussion is going to be wonderful. It's going to be awesome. It's going to be interesting. It's going to be eye-opening. Having met and interacted with Dr. Abayomi Ajayi severally, I can bet my last scope on tonight's discussion that is going to be wow. You know, so I'm imploring all our friends, all our fans, all those who have joined, and those who are still warming up to join us to get ready for a wondrously rollicking time.
Thank you so much. Thank you so much. It's always a delight having you, you know, interacting with you, interfacing with you, interviewing you, you know, because your wealth of experience and knowledge and everything, it always feels nice, you know, sipping, you know, from that fountain of knowledge, and that is exactly what is going to happen here again tonight. Thanks so much for joining us.
My pleasure. My pleasure. Anytime.
Yeah. Thank you, sir. Thank you. The first question is, what exactly does infertility mean?
Oh, thank you. Okay. Infertility is defined as the inability of a couple to have a child after they tried for 1 year.
Wow.
That is the general definition. But sometimes we modify it to look at the age of the woman. To say if a woman is over 35 years old and she's been trying for 6 months, then it is time to do something. Because as we go on, one of the things we're going to be talking about is the role of age and infertility.
Wow. So what exactly is the woman supposed to do after for 6 months, 1 year without any success?
Actually, what is the couple supposed to do?
Yes.
Now, they're supposed to see the doctor. Preferring at least who should be a gynecologist. Because the funny thing about reproductive medicine is not in the field of everyone's purview in medicine.
So, I like that.
So they should be seeing at least a gynecologist who will take them through the ropes. And there are 4 basic investigations that they should do. Because I get a lot of people coming to see me and they said, we have been investigated and nothing was fine. And I asked them, what have you done? And they've done only scan, you know. So 4 things needs to be done. The man's semen analysis will have been done because it takes 2 to tango. A woman can get herself. Yeah. Okay. They need to see to have done what we call an X-ray called HSG, which is an X-ray of the tubes, the uterus and the tubes, to assess the tubes. If they have not done that, they will have done at least something we call a laparoscopy, which I'm going to interpret later on. Anyway, so what we're saying is that there should be a way to assess the tubes, because the commonest reason in women why women don't get pregnant in our environment is problem in the tubes, why the commonest problem in the men is problem with the sperm. So those 2 tests should have been done, and then they would have done a blood test to see whether the woman is ovulating or not. Okay, and then they should do a scan. So most of the time, it's only the scan that people do, and they come back and say, "Oh, the doctor said there was nothing wrong with us." So one of the things I'm emphasizing, I'm using us, is that the man should always be there when a woman is going through these investigations.
All right. Now, Dr. Right. Now, what are the causes of infertility?
What are the
causes?
Oh, okay. All right. Let's look at it. We can categorize them into 4 broad aspects and say the man, when the man is responsible. 2, when the woman is responsible. 3, when the 2 of them are responsible. 4, when we can't find any reason for the investigation, for the infertility.
I like that. Okay.
And if we look at it this way, I'd say it's 100%. If we want to share percentages, we'll see that the man and the woman contribute equally to the causes.
Okay.
So if we put 30 to 40, then when there's combined, we have about 20 to 30, and then when we cannot find out why there is any reason for the infertility, which we call unexplained infertility, which is not because it's just what I said, we cannot find out, does not mean nothing is wrong. Then we say in this environment 10 to 20%.
Okay, now, can infertility be treated? And if yes, how can this be done?
Oh yes, infertility can be treated. Most infertility can be treated. All right. If we look at the way we categorize it, male, female, like we said, for the man, the problem with the sperm is usually the commonest problem. All right, and we can categorize this problem with the sperm also, depending on how low the count and how the range, the parameters are, into mild, moderate, and severe. All right. For the mild, you might try some things. Definitely, for example, if you find infection, maybe you can treat. Most of the time, that does not affect the fertility anyway. You can do a few things. You can even try what we call intrauterine insemination for the man, when the sperm count is just a little bit the range, just a little bit. But from about moderate to severe, for the man, when the man is affected, most of the time it's IVF.
Okay.
And the reason is that we still, our knowledge about male infertility is still a lot hazy. Actually, until recently, when we started studying more about male infertility, we just knew very little about infertility and male. But one thing we know is that drugs do very little or nothing at all in male infertility. And for female, IVF also is the commonest. Don't forget what I said, that tubal blockage is the commonest reason for infertility in women. So IVF also is the thing. So, but if you look at it, let's say, okay, we want to look at the 4 together. We can say we can categorize into drugs, surgery, and IVF. And if you notice, most of the things will answer to IVF. Very few things we answer to surgery. Okay. And these patients, especially for male and female infertility, have to be specially selected. All right. And then drugs, yes, if the woman is not ovulating, drugs will help. But if the tubes are blocked, drugs don't help. And then there is something horrible that we still do in this environment. They say they are flushing the tubes. You know, that does not do anything at all. It wastes time. It can risk the life of the woman. Okay, this is what I mean. Once there is blockage, all right? Okay. Let's look at the tubes. When we say the tubes are blocked, what do we mean? The tubes are like by centimeters connecting the ovary to the uterus. Okay, you know the egg is released from the ovary, picked up by the tube, so that it can come into, meet the sperm on the way, fertilize, and then come to the uterus to become a pregnancy. Now, because this tube also secretes fluids, just like, you know, just like your nucleus, you know, it also secretes, it has epithelium that secretes fluids. So if it is blocked, these fluids now gather together. Now, this gathering does, the first thing it does is that, you know, it's just like when we say when there is stasis, that when there is blockage, infection comes in. So it becomes infected, all right? And then someone now decides in his wisdom to go and flush this infected fluid. So sometimes it's possible that you're just going to dissipate bacteria into the abdomen of the patient. And so we don't encourage anybody to do that in 2020. That was a practice that was done 30 years ago. But right now, I don't think everybody should be doing that. So infertility can be treated, but the main, especially when we look at this environment where, just like I said, the commonest things will be low sperm count or bad sperm parameters and block tubes. The greatest thing, the greatest weapon that we have against infertility is IVF. Now, if the woman is not ovulating, then if that is the only problem, drugs will help. Okay.
Now, Dr. Abayomi, my next question is, what exactly should a couple try IVF? Because something that a couple can wake up and just say, okay, we want to try IVF. When should a couple consider IVF?
Okay, before you do any treatment, the first thing is that a diagnosis needs to be made. Okay. So the first thing I encourage any couple that is, that's why I said, if you are faced with infertility, you should see at least a gynecologist, because then the investigations can start. It is when the investigations have been done that we can know what exactly is wrong, and then we can profile solution. Okay. Now, if we find out, for example, that the sperm count is a problem, all right? For example, we did a study here in Lagos. We looked at about 1,900 and something sperm samples, and we saw that about 12% of the samples that we analyzed had no sperm at all.
Wow.
So
not at all.
No, it's a terrible thing. It's a very terrible thing. You know, what we saw was that one out of every two of the samples, the values were below par. So about 50%. But why we cannot say that it represents the whole population is that we're dealing with people who already know that they have some issues. Do you understand?
Wow.
So yeah, it's got to generalize for this whole population. But we also did another study comparing sperm count 10 years in 2003 to 2013 in the clinic. And we saw a decline of about 30%, the same population. So there is no doubt that something is happening to us as men.
Wow.
And in Nigeria is worldwide. You know, we've seen that sperm count has dropped about 50% in the last 40 years. You know, so we need to wake up to this issue of infertility, especially for men. You know, and then when we get to one thing, one of the things why we also say we should talk about is that there's a part of it that is preventable. So the idea is not just to give bad news. Okay. The idea is to see that people can do some things to help themselves before even infertility starts.
Wow. Why are women always blamed for infertility? Why is it that in most marriages, when the couples are finding it difficult to conceive, usually the women give the brunt of the blame?
Well, I guess culture has something to do with this.
Okay.
So, for a long time, we thought men can't have infertility, you know. And that's why anytime I'm talking, I always try to tell them that, look, it's a couple's problem. Okay? Because some men even come to you and they say, my wife can't get pregnant. I say, wait a minute. It's not that your wife can't get pregnant.
It's not a one-person problem.
It's not that your wife can't get pregnant, you know? Because I know that 50% of the causes also come from men. Okay?
Wow.
So it's not that my wife can't get pregnant. It's a matter of that we cannot achieve a pregnancy. You know?
Wow,
so
we can.
Yeah. Culture has to do with it. And then, of course, because it's women who get pregnant, it's their tummies that we see. They're worried.
I like that. It's the tummies that we see. You know, a lot of people get to hear about IVF. What exactly does IVF mean? I break it down so that the common man on the street can really understand what IVF means.
Okay, thank you so much. IVF means in vitro fertilization.
Okay.
It means fertilization taking place outside the body.
Okay.
What fertilization is the union of the sperm and the egg. Okay, for life to start, the sperm and the egg must come together and form what we call an embryo. That's what happens in a woman. When a man deposits sperm into a woman's vagina, he must meet with the egg, and then the embryo is formed, and then it goes. That's the function of the tube. It transports the egg from the ovary, and then the sperm mixes on the way, and the fertilized egg now goes back into the uterus. Now, when this fails to happen in nature, IVF takes the sperm and the egg and brings them together outside the body. And then when we have formed this embryo, which normally will form in the body, once we have formed this embryo, then we take it back into the uterus. So that's basically what IVF is. And from that point on, it's like you have planted corn. You know, once the farmer has planted the corn, every other thing is left to the Almighty to become. So when people were saying initially that some doctors are playing God, I just said, no, they don't understand. Nobody can please the Almighty.
Yeah, I love that. Now, Doc, the impression out there is that IVF is only for the rich and the famous. How expensive is IVF? How can people who, you know, how can you change that perception, that impression of people, of some people out there who believe that IVF is only for the rich and the wealthy and the famous and the, you know,
Well, I guess it's a misconception, and probably because it came from the fact that many years ago, many years ago, IVF could only be obtained in America, in the UK. It was something that we were saying, oh, in Nigeria, that it was almost impossible. So it was only the rich people who could afford it. And so then people thought, okay, fine. It was only the rich and the mighty who could afford it. But we know now that what I tell people is that if you can buy a Kutukumbo car, come on, you can afford that.
If you can do what?
If you can buy a Kutukumbo car in Nigeria, you can afford that.
Okay, so what a Kutukumbo can also afford to pay for IVF?
Trust me, and you know how many Kutukumbo cars you see on the road. So what I said, that's my customer.
I like that. The next question I was going to ask you, with how much can one procure IVF? Your answer that if you can afford a Tokumbo car, means you can also afford IVF, has taken care of that. Or would you like to shed more light on that?
Hey, say that again, please.
I said, the next question I'm going to ask you, so how much can one procure IVF? But you said, if you can buy a Tokumbo car, you can afford that. So I said, I'll answer the question, or I'd like to shed more light on that.
Well, you see, this is the reason why I try to avoid giving figures, because, you know, unlike some products, it's not a commodity, all right?
I love that.
What you need will determine how much you're going to pay.
Okay.
And so, because even when people come to do what we call inquiry, okay, which in my most clinics is free, all right? When they come and do inquiry, and then you mention the price to them, now the person doing the inquiry has not done investigations to know exactly what you need.
What the issue is.
So and then now they come and say, no, but that's not what you said. No, how could the person tell you exactly what? Because at that point in time, that's just like you know, when you want to buy a car, you know, they say there are options. You know, the basic, and then there are options. So the same thing right there. There's a basic idea some people need, which is not very expensive. But also there's some people need some other things.
Okay.
You know, some people need to do like a hysteroscopy, which is to look inside the uterus even before they can do any procedure. You know, hysteroscopy is anywhere in the scopy needs to look. You know, so there's something like a telescope that we can use to look inside the uterus without cutting people open. And then, because you know, in this environment, there's a lot of fibroids.
Wow.
So, yeah, so sometimes you need to do hysteroscopy, or you do fibroid surgery. We need to see whether they left a scar or not. So because we can treat the scar through the hysteroscopy. So there's some things that you might just need to do, which makes it difficult sometimes for you to just throw a price at them. Do you understand?
Okay. Yeah.
While many people say, look, come for the first visit, come and hear what we can do for you, and then have an idea of what the price will be before you commit yourself. But one other thing I want to do with Nigerians is that many people choose clinics because of cost. The cheapest is not always the best. The most expensive might not be the best. You understand? So when you have to choose IVF clinic, it's something that you need to do yourself. It's not what you do on the phone. How much is IVF in your place? You know? When I get such calls, I sometimes think the person is not informed enough. You need to go. You need to see the people who are going to look after you. You know, one thing I ask people is that, have you seen an egg before? Have you seen palm cell before? So the credibility of where you are going to do your treatment is so important.
Wow.
So you need to go and look at, and these people, okay, about 3 days ago, somebody came to the clinic. I'd known her for quite a while, and she sent me a message during the weekend that I want to come and see you. So I said, okay, come on Thursday. Yeah. Thursday, yesterday. Good. By the time she came, I was not even in the clinic, and they took her through the inquiry, and so I sent her a message after she left, and I said, "Oh, what do you think?" Well, she said, "You know something, I felt comfortable."
Wow, I love that.
Is the most important thing. You must feel comfortable with the people who are going to look after you. So it's not a matter of how much is this, how much is that. No, go there.
It's not something you buy off the shelf.
No, it's not about the self affair. Go there and see, are these the kind of people I want to deal with? Do they even have the kind of, when you can't even feel comfortable in a place, please, come on.
Some people are beginning to gravitate, to accept, to embrace surrogacy. Can you shed more on surrogacy? What exactly does surrogacy mean?
Okay, thank you so much, Azu. Surrogacy is an arrangement where a woman agrees to carry a pregnancy for either another woman or a couple.
Okay.
And she agrees that after giving birth to the baby, or babies sometimes, she will hand over to the people that have commissioned her to do that. Initially it was referred to as rent a womb. All right. So there's so many ways that this can be done. Of course, we say there is traditional, there is gestational surrogacy, but the traditional is fading. All right. Traditional surrogacy means the fertilization takes place in the surrogate. So let's get to two terminologies to start with. One is either the commissioning couple or the intended parents, okay? And the second one is the surrogate. All right? The surrogate is the person who is going to carry the pregnancy. Now, there's so many ways that this relationship can work. When we say traditional surrogacy, which, like I said, it's fading now, that means fertilization will take place. You remember the word fertilization again?
Yes, I do. Come together, yes.
The surrogate.
Okay.
In other words, it is the surrogate eggs that the sperm will fertilize. So the surrogate has a genetic linkage to the baby. That is traditional surrogacy.
Okay.
Now, the fertilization usually will not involve IVF. It's what we call insemination. And now abroad, you don't even need to get to the hospital to do insemination. You can do it yourself. So that's surrogacy. But with surrogacy, which is the commoner ones, the commoner one now it is the baby is not genetically related to the surrogate. So it's either you are using the sperm and the egg of the intending parents or commissioning couple. All right. I hope I'm carrying you along.
Yes, you are. Yes, sir. Right answer.
Yeah. Okay. Or you can even have a situation where, for example, the woman does not have eggs anymore. So you can use donor eggs. The husband of the intending union, and then the surrogate only carries the baby. It's a uterus alone that we're using. The same thing if it is the man that does not have sperm count again. You can have the woman's egg and a donor sperm and form the embryo, and then the fourth way you can even have that the two of them don't even have sperm, they don't have eggs. The two of them can use donor sperm, donor egg, and the surrogate will carry for them. Do you understand?
Wow.
Now, this arrangement, if you will see that is a little bit complicated. So he has a legal agreement backing it up. The legal agreement says that the surrogate will give up the baby or babies after birth.
Delivery. Wow.
Okay. So from the get-go, she knows that she's not going to, this pregnancy is not her own. So she's compensated for that. Okay. And we see some people who, I mean, I had an interview like this a few weeks ago where some people from the UK organized, and they were talking about surrogacy specifically. And on the panel was a surrogate.
Wow.
Okay, who was preparing to go a second time to get pregnant to give out to the couple. That she said she wants to help people. No, wow. So there are people like that also who do that. But also in Nigeria, there are people who do that. So wow. That is the complication in Nigeria is that I'm not a lawyer, but we've used a lawyer for about 14, 15 years now who has been working with us. But there are no laws about surrogacy in Nigeria yet. And wow. Sometimes also they confuse surrogacy with this baby factory. And they are poles apart. One is completely legal, the other one is
illegal. Wow, wow.